privilege. It is a privilege to get to know all four of you and to get to hear your stories. You're all working in discrete areas of health innovation, and yet there are many crossovers that we can explore today. So we'll just start with a round of introductions. So tell me who you are, and by way of your health moonshot, give us a vision of your company. So Stuart, we'll start with you, and we'll move down.
I'm Stuart Jacobson, the CEO and founder of Biome Analytics, and our mission is to help hospitals and doctors work together to drive superior clinical and financial performance in cardiovascular care.
Sebastian?
Yeah, I'm Sebastian Coates, the CEO, technical founder of Telescope. We provide a complete solution that allows businesses to manage and scale the complete digital patient experience.
Chris?
Hi, I'm Chris O'Brien, CEO of AdhereTech. Our focus is working on the most difficult problem in healthcare in America and around the world, medication adherence. We do that with a series of smart devices that patients can use in a totally passive way, and then through our platform can get patients help very quickly when they need it.
Yeah.
Awesome.
Hey, I'm Asif Khan, CEO, co-founder of Hucu.ai. We are a person-centered messaging collaboration platform built really for value-based care. So people in post-acute care, they can collaborate with each other for caring for patients that are Medicare and Medicaid beneficiaries.
Awesome. All right, the first theme I want to explore is finding the signal and the noise of big data. And I want to point this to Chris and to Stuart. Big data, has been a buzz term in health innovation for a long time. And both of you are getting very smart about how you laser in on, actionable data for providers. So I want to hear from both of you how you're doing it, and then also maybe strategies for other startups and entrepreneurs for seeing the signal and the noise. So Stuart, I'll start with you, and then we'll go to Chris.
Okay, so my experience is that it's not really big data in healthcare, it's complex data.
What do you mean by that?
So compared to viewing internet log files or monitoring security and looking for penetrations and managing logins and things like that, we don't have that kind of continuous volume. To drive real change in healthcare, really immediate change in healthcare, it's all about getting the doctors and the administrators aligned, and because they're the source of most of the cost, and there isn't just a high volume of data, but it is extremely complex data. So being able to sub-cohort and understand what moves doctors' behavior, giving them the evidence that you can defend is really key to driving transformation, at least in our space, which is the acute care setting.
Give me an example. I know you work with cardiovascular centers, and you have specific ways that you use data. This is what fascinates me about Biome Analytics. You use it like a scalpel to change behavior. So give me an example of how the numbers change behavior.
Okay, so doctors are really busy. They don't often understand the implications of their care, their best practices. They don't have perspective on how they're doing compared to their peers. Most of the data they're getting is, I use this analogy a lot, but it's like giving a baseball player their earned run average. It really doesn't help them improve their swing. So to really get doctors to change their behavior, and the reason this is important, because doctors are the primary source of quality and cost, you have to give them data that is defensible, meaningful, and clinically relevant to them. So that can include an understanding of how they're overutilizing material in the operating room. It can help them figure out optimum dosages for contrast agents, and I could go on for hours.
Chris, how about you?
Well, at AdhereTech, we have a somewhat different take on it, although I very much agree on your relevancy point. We have smart devices, smart pill bottles, caps that patients can use at home to take their medication. And what that does is create a signal out of the home. These devices are connected over a cellular network securely to our back-end platform, and then we integrate with whatever the care setting is for that patient. So it might be, for example, Tennessee Oncology is a very large oncology practice in Nashville. They're using our platform to monitor recently diagnosed oncology patients. And so what we're doing is really solving this information gap that exists between the clinic, where they know everything about the cancer you have, everything about the disease you have, down to the genetic variant, to what happens outside of the clinic. What's happening at the home? What is patient behavior? How does all that feed together? And of course, physicians have been struggling with adherence since Galen. But what's different today is that there are whole teams of people, both in value-based arrangements and within the clinic, that are responsible for that adherence. So we create data out of the home. Through our devices, we can see what patients are doing. There are sensors on our bottles. We tell when the bottle is open. We can see when the doses are taken. We marry that data together with the clinical data that we get from the physician's office, the pharmacy, wherever integrated, and then passively monitor those patients in real time. What that creates is this whole new data asset that's never existed before of what on earth are those patients doing outside of the clinic. And instead of having to intervene with all those patients, we create that knowledge of which patients are in trouble today and need a call, versus which patients are doing just fine and you can wait till they come in to the next appointment. But it's really that combination of the patient behavior data along with the clinical data that creates the biggest opportunity.
One thing I find interesting about AdhereTech is that you're tackling that signal to noise problem on both the patient side and the provider side, because we've had a history of smart pill bottle type technology that gave us alarm fatigue, that you're fighting against. How important is it for you to understand just that daily struggle on the patient side?
Well, the first thing is you really need to get patients to use it. And if you think about your traditional digital health approach to medication adherence, over the last 5 or 10 years, we've had apps, we've had gamification, we've had incentive programs. And the problem with all of these things is there's really nothing in it for the patient. You just got diagnosed with MS, you're on a new med, you're struggling with side effects, and wait, I've got a game and you want to pay me an extra $3 a month to take my med? It doesn't make any sense. And so because of that, your traditional digital health approaches just really never reach enough patients. And what's great about our programs is all you have to do is use a different pill bottle. If you can use a pill bottle, you can be in the program. So at a population level, we're getting enough patients into these programs that it's actually creating a meaningful economic difference for the sponsors of our programs overall. And yeah, the key thing is, don't do anything with the patient if they're doing just fine right now, and don't bother the clinician if your patients are doing just fine. So that getting into the office in the morning as an oncology nurse and seeing a report of all of the patients you're managing, who's doing okay today, who's taking their dose late. We had one example recently where somebody started taking their oncology med every other day. And so the nurse called up and said, hey, what's going on? Oh, I just lost my job. I'm worried I won't be able to afford it, so I wanted to stretch it out. Well, that's not a very good idea. And through the connection to care, we were able to get that patient connected with a grant program so the patient could stay on therapy until their insurance came back in.
Thanks, Chris. Sebastian, Asif, I want to talk to you about creating solutions that meet healthcare providers where they're at and kind of what it takes to get into their shoes and understand the challenges, because I know both of you have created solutions that really understand the workflow of the physician and really try to tap into some gaps that hadn't been filled before. So Sebastian, we'll start with you. Kind of what did you build that fills those gaps? And B, how did you get into the physician's shoes and understand?
Sure. So, it was talking to them, talking to the customers, building out these digital solutions, right? So we're primarily selling into digital-first practices. But what you have right now is a lot of physician burnout, a lot of physicians who have been forced to do telemedicine. And just like a lot of us, they're stuck talking to a patient and switching between 12 different tabs in their browser and just not being able to deliver the best care that they can and not be able to be as efficient as they can, which ultimately affects the patient experience down the line. So, our goal ultimately is to really have a solution where a physician at scale can manage all of their patients from a single place, have a complete picture of each patient, and interact with them exactly how they want to meet their preferences.
And remind us kind of how that developer-first mentality, how that works, the kind of system that you've created.
Sure. So every company is different. Every company is innovating with a new care model, a new source of data that can be useful in delivering care, and they need a system that can accommodate that. as a developer myself, I know that most companies are using developers to achieve that effect. So we've been really friendly with them. So in parallel with providing this, out of the box great experience for providers, we're making sure that developers can have their specific use case as relevant and applicable there too.
So Asif, you've created this great new way for providers to communicate with one another. What was broken about that communication landscape that brought you into it?
Well, everything is broken about it. I mean, think about all the different people. Like, if you are sick or anybody that you loved was sick, how the heck do you communicate? I mean, you phone this person, you call that person, you fax something, you email something, you text something, and none of them are talking to each other, and you're the one who are having to bear the brunt of doing it. I mean, it's everything that you can imagine is broken with that. So what we did, because I've been here in post-acute care for the past 10 years, trying to solve that problem, and I think we finally got it. So it's think of it like a Slack channel or a Teams channel, but its channel is for a patient. Like just like in EHRs, you have charts, patient charts. In Hucu, you have patient channels. In that patient channel, you can bring anybody together, like a doctor and a nurse and a home health and a hospice and a therapist. And now you start communicating on one side with the clinical team, and then you press a button, you switch mode, and now you can communicate with the patient or their family members too. So that ability to collaborate and give people time back, because especially in post-acute care for caring for seniors and Medicaid populations, it's a lot of chasing. Some of our case managers, they say they save 3 to 4 hours a day because they don't have to look for people or look for information, so it's already there. And above that, as people communicate, we adjust the acuity score for each patient. So now it's even more easy to manage my population in real time because people are doing their job. They're just communicating via secure text in Hucu, but we take that information and we say, oh, out of these 2,000 people, these 20 are high risk. So everybody can focus on those. So we're just trying to augment and simplify the chaotic workflow that's out there for patient care in post-acute.
What's really inspiring to me is how these macro ideas, they filter down to real patient lives. Right. Sebastian, you mentioned the idea of physician burnout. So, a communication tool might give you a few more hours of your day, right, but it's giving life to the physician, yeah, and to the patient. How do you think about that?
Yeah, I mean, I think one of the interesting things that we found is a lot of chaos and, patient problems can be avoided if the right person is involved quickly, and you don't have to think about, okay, so for example, in a skilled nursing facility, and there are nurse practitioner and provider groups that use Hucu to collaborate. A lot of times, those people in skilled nursing, they're transient in post-acute care, right? They're here today, gone tomorrow. They don't know who to call, what their phone number is, what their title, they don't know. But what we built in Hucu is they just press a button and the right person gets automatically injected into the channel. And we are seeing actually hospitalizations being avoided, timely wound care being done. I mean, it's remarkable, like how fast you can make decisions, if you don't have to worry about who to talk to.
Yeah, and it's in a format that many people are already familiar with.
Yeah, if you know how to text, I mean, that's the most dumb way to communicate right now.
All right, I want to hear what your next health moonshot move is. I want to hear what you're most excited about for the next year for your company. We'll start with Stuart and go down.
Well, we just want to keep doing what we're doing, basically. We've saved, on average, 10% of the direct cost of care in most of our clients, and that's tens to hundreds of millions of dollars in larger health systems. And we just want to get the word out and use our case studies and continue to do that over and over again.
Who's your ideal client, partner? I'm going to add this to the lightning round.
The ideal
partner.
Partner
or client.
The ideal client is a forward-leaning cardiovascular center who really wants to deliver the best possible care at the lowest cost and treat more patients with the money they save and the time they create. But the key is being ambitious. It's the ambitious teams that are the ones who make the big difference.
Okay. And Sebastian?
Yeah, so we know that every dollar a company spends on stuff that's reinventing the wheel is a dollar wasted and a dollar that could have been spent on better patient care. So that's kind of our guiding light. And as we talk to customers, we understand and learn exactly what we can provide so they don't have to do that needless work. So that's the guiding light right now. What that means, I think, in the near term is building all the integrations that people are stuck doing themselves again and again, not just to improve our platform, but to make sure that our customers can deliver care faster and better.
Ideal partner that you'd love to hear from this year?
Yeah, we've been excited to work with earlier stage startups who are really pushing things forward, have a new care delivery model that they're excited to explore and that we can support them with. Innovation groups at larger funds or larger institutions that are exploring digital health are also really exciting partners moving forward.
Awesome. Chris?
Well, obviously, there's an enormous human cost to medication non-adherence that we're very focused on, but there's also this huge economic cost. So historically, most of our customers have been medical centers, pharmacies, pharmaceutical manufacturers who are bearing that cost of people dropping off their meds. But this year, we're really focused on starting to get into discussions with at-risk provider groups, payers, places where we could work with much larger bodies of patients. So we very much want to hear from anybody who's in an organization where they are bearing that economic cost of people across America who've stopped taking their meds and they just don't know which people it is.
Yeah. Asif?
Yeah, so for us, we take partners and clients the same way. So anybody who is looking to optimize and get data around what's working in community-based care for Medicare beneficiaries, for Medicaid people, how my networks are working. If you have value-based contracts or if you want to get into value-based contracts, those are the people that come and we talk and we give them the data and the analytics to see how their care delivery collaboration is going, because that at the end of the day dictates how well you're taking care of your population. And with respect to specific partnerships, I think just like Sebastian was saying, we have APIs on the messaging. So any digital health startup or technology company, messaging is a whole different tech stack that you need to get an expertise on. So Hucu, we have widgets and APIs. So any tech company, if you want to message, you can use Hucu as a plugin for your messaging capability.
Nice. We have one more minute, and there's some real experience on this panel, and I want one of you to say to me, what's a piece of advice that you would give to your younger self on the eve of starting your current business? I'm thinking of, Asif, I know this is your second, health innovation company.
Right.
What comes to mind?
I think healthcare is slow, so you gotta pace yourself. But at the same time, opportunities arise, and you gotta be agile. So I think it's a constant balance in where you wanna push and where you wanna pull, and that's just one thing.
Beautiful, beautiful.
I would add to that, I think that healthcare is an enormous different market, and many of the problems are very, very intractable when you looked at from a wide angle lens. And so what I would say is just, find that thread that you're going to pull on as a startup. And don't maybe just pick one when you're very early, but just, you got to find that core use case where you're absolutely a no-brainer for that customer. And even though lots of people may be interested in what you're doing, you'll know when you find that one that you're going to be able to change their business in a material way.
Thank you all. Thank you for taking the time with us, explaining what you're building, but even more, just thank you for the work that you're doing to make patients' lives better and healthcare providers and just helping improve healthcare for all. So I applaud you.
Yeah, thank you, Logan. Good job.
All right. Thanks, everybody. If you want to learn more about these companies as these guys take off, you can learn more at startuphealth.com. You can come down to the pavilion.